This is a video in clinical medicine from the New England Journal of Medicine.
Circumcision of the male newborn is a surgical procedure used to remove the foreskin of the penis, including the inner foreskin exposing the glands. Neonatal circumcision is one of the most commonly performed surgical procedures. This video will demonstrate the technique of circumcision with the use of a circumcision clamp device. Circumcision is performed for a variety of religious and cultural reasons. It is frequently done at the request of the parents. The American Academy of Pediatrics has concluded that current data are not sufficient to justify routine neonatal circumcision. However, current scientific evidence indicates that circumcision has some medical benefits. These include a lower risk of urinary tract infections and a lower risk of transmission of the human papillomavirus and the human immunodeficiency virus. Circumcision may prevent phimosis, paraphimosis, and infections of the foreskin and glands, such as balanitis and balanoposthitis. Proper hygiene can also lower the risk of these conditions. Several methods and devices may be used for circumcision. 3 commonly used devices include the Gomco-type clamp, the plastic protective bell, and the Mogen-type clamp. The most frequently used clamp for non-ritual circumcision is the Gomco-type clamp, and its use will be demonstrated here. Anatomical contraindications include hypospadias, corti, epispadias, penile torsion, buried penis, webbed penis, urethral hypoplasia, and ambiguous genitalia. Medical contraindications include prematurity, age younger than 18 hours, known bleeding diathesis in the patient or the patient's family history, any current illness or medical condition that requires monitoring, and disorders of the skin or connective tissue that would impair normal healing. Gather the equipment necessary for the procedure. The non-sterile equipment includes a restraining board with leg straps and padding, 24% sucrose water and a pacifier, supplies for local anesthesia such as a 1 milliliter tuberculin syringe, a 30-gauge needle for injection, and 1% lidocaine without epinephrine, an alcohol wipe, 4% chlorhexidine gluconate, white petroleum jelly, and a disposable diaper. Sterile equipment includes sterile gloves, a sterile drape with a 2.5 centimeter fenestration, sterile towels, sterile gauze pads, 3 small straight hemostats, a flexible metal probe, straight scissors with 1 blunt tip, Gomco-type circumcision clamps in sizes of 1.1, 1.3, and 1.45 centimeters, and a number 10 scalpel blade. Other equipment you may need includes absorbable hemostatic gauze, 1% lidocaine with epinephrine, topical thrombin, and 5-0 absorbable sutures if needed to control bleeding. Obtain written, informed consent from a parent or legal guardian. Make sure that the infant has voided at least once since birth, since anuria may be an indication of distal urinary tract anomalies that would contraindicate circumcision. At least 1 hour should have passed since the last feeding, because of the risk that the baby might regurgitate. Parents or guardians should be given the choice of remaining with the child during the procedure or waiting nearby. After everything is ready, place the infant on the restraining board. Inspect the penis and scrotum for abnormalities, and then prepare the skin by cleansing with an alcohol swab. Circumcision should be performed with analgesia. Regional analgesia limits the pain reduction to the surgical site and may prevent occurrence of the side effects of general anesthesia. Nerve blocks of either the dorsal penile nerve or the subcutaneous ring have been shown to provide better pain control than topical anesthetics. The dorsal nerve block is performed with the use of a 30-gauge needle attached to a 1 milliliter syringe. Inject 0.4 milliliters of 1% lidocaine without epinephrine at the 2 o'clock and 10 o'clock positions at the base of the penis in a posteromedial direction and to a depth of 0.3 to 0.5 centimeters beneath the skin surface. Allow 5 minutes for anesthetic effect. A pacifier dipped in sucrose water should be given to the baby during the nerve block and during the procedure. Thoroughly scrub the penis and around the base of the penis with at least 3 applications of chlorhexidine gluconate. Then position the fenestrated drape. Note that Gomco-type clamps come in several sizes. Select the correct clamp size. A typical size for newborns is 1.3 centimeters. Estimate the appropriate size on the basis of the circumference of the glands. For a correct fit, the edge of the bell should reach the frenulum and extend minimally over the corona, slightly stretching the foreskin. Ensure that the clamp assembles correctly with the top surface of the base plate positioned against the bell. Make sure that the bell is the correct size for the clamp, allowing no light to pass between the base plate and bell. Check to ensure that there is a minimum distance of approximately 2 millimeters between the arm and the base plate, and then tighten the nut to ensure optimal clamping. A Gomco-type device with poor contact may not allow adequate lever space. This graphic depicts the worn or poor contact points on a Gomco-type clamp that may result in a lack of lever space between the arm and the base plate. Grasp the foreskin with hemostats at 10 o'clock and 2 o'clock with a shallow bite not exceeding 0.5 centimeter, taking care to avoid the urethral meatus. Using the blunt metal probe, free the foreskin from the glands to the level of the corona, keeping the probe tented to ensure that it does not enter the meatus, and avoiding the 6 o'clock ventral position at the frenulum, which contains the anterior branch of the bulbourethral artery. All adhesions between the foreskin and glands must be separated completely. Next, create a dorsal slit. First, use a straight hemostat to crush the skin and mucosal layers about halfway between the edge of the foreskin and the corona, but no closer than 0.5 centimeter. Wait 5 minutes. Remove the hemostat, and then cut the crushed tissue with the blunt end of the scissors placed between the foreskin and the glands. Retract the foreskin with the 2 hemostats and fully expose the glands. Bluntly separate any remaining adhesions with the straight probe or gauze. Check for previously unanticipated anatomical abnormalities. Place the bell of the clamp on the glands and use a hemostat to hold the foreskin around the stem of the bell. Remove the hemostats at 10 o'clock and 2 o'clock. Insert the stem of the bell into the hole in the base plate from below. Reach down through the base plate with a hemostat and hold the foreskin around the stem of the bell. Remove the hemostat from below the base plate. Ensure that equal amounts of foreskin are pulled through the base plate circumferentially and that the apex of the dorsal slit is visible above the base plate. Attach the rocker arm of the clamp and make sure that the arms of the bell are settled into the yoke. Tighten the nut, which will crush the foreskin between the bell and the base plate. Keep the clamp in place for at least 5 minutes. Then, using a scalpel, excise the foreskin, making sure to remove all tissue above the clamp. Loosen the nut and disassemble the clamp. Ease the skin off the bell with cotton gauze. Assess the penis to make sure that any adhesions have been removed and that the circumcision is adequate, fully exposing the glands. Check for bleeding. A topical anesthetic cream may be applied for immediate postoperative pain control. Apply petroleum jelly to cover the area and instruct the parents or caregivers to reapply the jelly with each diaper change during the next 5 days to keep the diaper from sticking to the glands. Administer acetaminophen, 10 milligrams per kilogram of body weight every 6 hours as needed for pain and irritability during the immediate postoperative period. Parents or caregivers should be instructed to call the doctor's office if there is excessive bleeding, fever, or failure to urinate within 12 hours after the procedure. Follow-up with a provider should occur within 1 week. Circumcision may lead to a number of complications. Too little or too much skin may be removed. Selecting a Gomco-type clamp that is the correct size will help to ensure that the correct amount of skin is removed. If too little skin is removed, the result can be a buried penis. In such instances, pediatric urology consultation should be considered to revise the circumcision. It is advisable to leave too much rather than too little foreskin. If too much foreskin is removed, the result may be an exposed penile shaft. An exposed shaft may result in bleeding. Bleeding may be controlled by applying pressure, using absorbable hemostatic gauze, administering 1% lidocaine with epinephrine or topical thrombin, or suturing the cut edge with 5-0 synthetic absorbable sutures. Consultation with a pediatric urologist is recommended for revision and for uncontrolled bleeding. Routine neonatal circumcision is performed for a variety of reasons, and there is some evidence in support of its benefits. However, good hygiene may also achieve some of these aims. Routine circumcision is not recommended by the American Academy of Pediatrics. There are contraindications to performing circumcision, and these should be reviewed for every patient. The Gomco-type clamp protects the glands during the removal of the foreskin. Complications are rare and can be minimized by selecting a Gomco-type clamp that is the correct size. Consultation with a pediatric urologist is recommended if complications arise.